Welcome to this 𝐸𝐤𝐾𝐫 knee planner tutorial. This video will show you how to use your preferred alignment method for your next total knee surgery, using the 𝐸𝐤𝐾𝐫 knee planner and surgical guides. Following these 6 steps will help you plan your next patient case. We will demonstrate tips and tricks that will help you assess and fine-tune your surgical plan and personalize the planning for each patient. As a first step, start reviewing the preoperative varus valgus angle in the pre-op section. The information about the patient's preoperative HKA angle can be used as input in later steps when fine-tuning the plan for a more personalized alignment. Now you can deactivate the implants and activate cartilage and landmarks. The cartilage color map provides insight into the cartilage wear patterns on the articulating surfaces for each patient. Assess cartilage wear at the location of the distal and posterior landmarks of the femur and at the proximal landmarks of the tibia. The amount of cartilage wear can be considered when adjusting alignment and resection levels in the next steps. To fine-tune the femur, switch off cuts and colored resections and activate the implant. Now follow these 4 actions to fine-tune the position of the femur implant. Choose the rotation of the femur by selecting the rotation reference that is most suitable for your patient. You can switch between 3 reference axes: the epicondylar axis, the white sides line, or the posterior axis. Switch to the posterior axis and visually assess how well the rotation aligns with the patient's posterior condyles. If you like to follow a resurfacing methodology, you can move to the posterior reference axis with 0 degrees external rotation. Then assess posterior resection levels medially and laterally and fine-tune based upon your clinical judgment. Now refine distal resections. Go to the 3D view and deactivate the tibia. First, do a visual check of the cartilage wear patterns and assess how you want to compensate for cartilage wear. You can adapt the distal resection level and function of the patient's anatomy in your alignment philosophy. If you want to follow a resurfacing philosophy, you can change the varus valgus angle of the femur, which will impact the distal resection level. To find the optimal size for your patient, there are a couple of things you can consider. You can try one size bigger and one size smaller. Check that there is no notching or limited notching. Review there is no anterior overstuffing. Assess implant overhang onto osteophytes. Optionally, you can do some final checks. Switch off implants and switch on the colored resections. Check the piano shape in the frontal view and check the butterfly shape by moving to the inferior view. Activate the tibia now to verify the tibia resection, implant size, and position. Follow these 3 actions to fine-tune the position of the tibia implant. You can first do a visual assessment of cartilage wear patterns. Adapt the varus valgus angle and function of the patient's anatomy in your alignment philosophy. Note that this will impact the proximal resection levels. You can use the standard slope recommended for this implant or assess the patient's native posterior slope by switching on the colored resections and moving to the medial view. Assess the angle between the tibia plateau and the resection on the medial side and adjust the slope further manually based on your clinical judgment. Now, review and adjust sizing. Move to the superior view, switch off colored resections, and switch on implants. You can try one size smaller or one size bigger and verify implant fit. It is easy to verify overhang. Overhang will be shown in red. You can modify the AP and ML position of the implant interactively. You can do a final check on the tibia position in relation to possible presence of osteophytes by moving the tibia in 3D. During planning, you can always review the impact of your changes on the flexion and extension gaps in both the 3D view and the 2D view. Note that there is no information on soft tissues included. To end, perform a final review. Click the Approve button to validate the plan and order guides.